I wish to acknowledge the Darkinjung people as traditional custodians on the land on which I live and work. I pay my respects to the elders past and present and recognise their continuing connection and contribution to the land.
Immunisation Foundation of Australia. Supporting immunisation, saving lives.
The Immunisation Foundation of Australia is a non-profit working to save lives through education and advocacy for vaccine prevention of disease. Welcome to Matter of Vax. I'm your host, Steph O'Connell. Join me and find out what is Matter of Vax. In 2007, Australia was the first country to roll out a national vaccine program for HPV. It was an enormous step in the prevention of cancer and significantly for cervical cancer. What is human papillomavirus? Who is at risk? What are the longer-term consequences of infection? We explore the link between cervical cancer and HPV infection and ask who should be vaccinated. We find out how this vaccine could change the global footprint of cancer in women. We welcome Professor Julia Brotherton. Professor Brotherton has spent 15 years involved in research and policy development and informing the implementation and evaluation of HPV vaccination and cervical screening programs. Julia is a public health physician and Professor of Cancer Prevention Policy and Implementation at Melbourne School of Population of Global Health, University of Melbourne, and a professorial fellow at Australia's National Centre for Immunisation Research and Surveillance. Professor Brotherton is also a member of the World Health Organization Director General's Expert Committee on Cervical Cancer Elimination. Please welcome Professor Brotherton.
Thank you very much. It's great to be here.
This is such a big subject, Professor. What is human papillomavirus and just how common is it?
Human papillomavirus is certainly a mouthful. People have trouble saying it, so that's why we usually abbreviate it to HPV. As you can tell from the name, it's a virus that infects humans only, and there's certain groups of the virus that like to either infect our skin or our mucosal surfaces. And that sounds very technical, but what that means is areas like our genital region, our mouth, areas that are sort of more moist. And it's these types of HPV that we're talking about when we start to talk about diseases against which we now have a wonderful vaccine, the HPV vaccine. So these viruses are very, very common. The ones that we're interested in, these mucosal viruses, are a very, very normal part of being a sexually active human. If you've ever been sexually active in your life, it's highly likely that you've already encountered these viruses and never even known it. And this is why they're often called the common cold of STIs. Most of the time, they're very sneaky viruses. They don't have any symptoms. You get them from sexual contact of some kind. All it takes is a tiny little microabrasion in the surface of the skin there, and this virus can get into the cells, and it's really good at dodging your immune system. So typically it takes us about a year or two to actually get rid of that virus, but most of us, our immune system eventually finds the sneaky little bugger and gets rid of it. And it's no drama at all. You know, you might wonder, well, why on earth are we worried about these viruses? And the reason is that in some cases, it can evade our immune system, it can stay in the cells, and that's when we start to have problems.
I imagine that most of us at some point in our lives will not only come in contact with it, but will contract it. Is that correct?
Absolutely. Modelling that actually comes out of America, but very similar population to us, is estimated that at least 90% of us will have this virus at some point in our life. Most of the time, it's of no consequence. We don't even know we've got it. And we just carry on. Probably about 10 to 15% of us whose immune system, for whatever reason, doesn't manage to track down that virus, and the virus really sort of sets up in those cells there. Over time, it can cause changes to the cells, and this is when we get disease. And sometimes, rarely, but it does happen, cancer. And that's when the ability to prevent us getting the virus at all comes into play.
longer term consequences, infection in both men and women. What does that look like?
There is only certain types of human papillomavirus that can actually lead to the most serious outcome, which is cancers related to the presence of this virus in the cells over a long period, usually over decades. That's how long the virus has to be sitting there, creating an environment in which the cell really can't repair itself from any other damage, and that's over the long term when you get cancers developing. There are currently 12 of the HPV types. That's what the scientists have decided, that we actually number HPVs. So it's HPV that's number 16 and HPV that's number 18 are the ones that are the most likely to persist and eventually over a long period of time cause cancers. So these are the ones that certainly, when we decided that we really wanted to try and prevent infection with these viruses, they're the ones that we targeted. So those most, we call it oncogenic types. But there are other types that are less oncogenic, and they're the ones that we're looking for when we're doing screening now to try and prevent cervical cancer through screening. And there are actually a whole lot of other HPV types that are not cancer-causing. And we call them low-risk types, and they're the ones that we don't get any symptoms from most of the time. There are two types, 6 and 11, which are associated with genital warts. Now, obviously, genital warts are unpleasant, embarrassing. They usually go away on their own, but they can be a bit tricky to treat. So, again, that's another thing that when they were developing the vaccines, they said, wouldn't it be great if we could prevent those as well? So indeed, the vaccines actually prevent those types of HPV infection as well, with the 6 and 11, as well as those 16 and 18, the ones that we really worry about, because they are related to about 70% of cervical cancer cases, just those two HPV types.
Australia was the first country to roll out a national vaccine program in 2007. I understand we're doing very well with that. Also, this has been your life work, and this is a truly significant vaccine.
Australians have kind of adopted this as something that we're all rightly proud of, and that's, as people may recall, that it was Professor Ian Fraser who was Australian of the Year in 2006, and his colleague, Dr. Zhao, who was working with him in his laboratory, who were the first to really uncover this amazing scientific discovery that allowed us to develop these vaccines. So as I said, these viruses are really tricky little things, and the laboratory scientists have always had huge troubles trying to grow the virus in a lab situation, which made developing vaccines really, really difficult. What they discovered was, in fact, a way of expressing different types of cells. You can get them to express a protein which is on the outside surface of the HPV virus. And what they discovered was if they got the cells to make this protein, they automatically self-assembled into round, spherical-like particles that looked exactly like the virus.
How convenient.
It was an amazing discovery because, of course, there's no viral DNA in there. There's nothing nasty in there. It's just a protein. But your immune system thinks it looks exactly like the virus. So it produces a fabulous response. It says, this looks like a virus. I'm going to produce some good levels of antibodies. And what that basically means is if you receive the vaccine and then in future you encounter the real virus, your body clears it immediately without it ever being able to actually get into your cells in the first place. So that's how this vaccine works. It prevents infection in the first place. So in fact, if you already have an HPV infection and you get the vaccine, unfortunately the vaccine's not going to help you. But if we get it into people before they're exposed to those types of HPV that could potentially cause problems, it's almost 100% effective. It's quite amazing. And I think this is why we were so rightly proud of Professor Fraser's role in developing these vaccines, because it's a game changer. Being able to prevent a cancer, it's really quite remarkable. They did huge randomised control studies to see if the vaccines worked. And just as I was sort of, establishing my career after all my public health training, was the time when the very first paper was published, actually in the New England Journal of Medicine, showing how incredibly effective these vaccines were with like 100% efficacy.
Wow.
Blown away. So I was lucky that was the time I was starting to work in the vaccine area, and we were tasked with thinking about, once these vaccines are licensed, what will they look like in Australia? Will they benefit our population? What types of HPV cause disease here? All of those questions, which we then had to go away and think about. And then, of course, by the time the vaccines were introduced in 2007, because we were, I guess, very keen and so excited and people really were calling out for this vaccine, we then, as you said, launched a massive HPV vaccine program, first in the world to publicly fund it. We achieved high uptake, and it certainly wasn't long at all until we started to reap the benefits of the vaccine. And by that I mean we saw decreasing rates of genital warts very, very quickly. It's extremely uncommon in young people now.
Isn't that wonderful?
Well, health physicians were, that used to be my main job, treating those, and I don't see them anymore.
Wonderful.
Because we have also a wonderful screening program in Australia, and we still do, we were able to use our registers to actually see that we had a decreasing rate of cervical precancers being picked up in young women, because once you prevent the infection, you prevent the disease. So it meant that women, when they were attending screening, they were less likely to have an abnormal result. They were less likely to be diagnosed with a precancer and have to receive treatment for it. So just amazing news. And in fact, we really changed what we call the epidemiology of the disease. Those types that we were vaccinating against, that 16 and 18 that I said before, those ones that we're most concerned about, basically started to disappear in young women. Remarkable. And we've really been able to show just how amazing these vaccines are. And we've also documented how safe they are. And this is one of the most wonderful things, I think, is, looking back, we were so lucky we had those huge randomised trials at the beginning. There were, of course, what we call vaccine safety signals. So that is when someone thinks, there's a cluster of people who've developed some condition after vaccination. And that often happens. Unfortunately, people do develop new diseases. But we now have 16 years of data that show that none of those conditions occur more commonly in people who receive the HPV vaccine. And I feel very confident telling people that this is a very safe vaccine, and it's really a gift that you can give to your child to prevent them from cancer. And it's not just cervical cancer. So it's worth saying that certainly is the main cancer that the vaccines were developed for originally, and that's because it's by far the most common HPV-related cancers. But there are other cancers that this vaccine can prevent. And of particular relevance, the ones that occur in both male and females, is anal cancers, which are very, very strongly associated with HPV, and unfortunately a very difficult cancer to otherwise prevent and to treat. You wouldn't wish that cancer on anybody, because it's a real feat of endurance to try and then cure that cancer. It's really difficult. And also some of our head and neck cancers, so particularly the ones that we call the oropharynx, so the back of the throat. A lot of them are related to HPV as well. So being able to offer protection throughout their life to your child with a simple vaccine is just amazing.
And this is also having a very big impact across the world.
Yeah, absolutely. So we were lucky because we were first cab off the rank. We saw those impacts early, but it's absolutely been replicated throughout the world, both in high-income settings like our own, but also in low-income countries. And obviously the burden of particularly cervical cancer, which is a disease of inequity and poverty, because many women around the world don't have access to any screening at all. In the last couple of years, we've seen definitively in several countries now that it prevents cancer. We now have great data from America, from Denmark, from Sweden, from the UK that show, yes, cancers are being prevented.
I just think this is one of the most interesting of vaccines, and such a textbook case of great medical engineering.
And I think it's worth calling out that, of course, it's not just the efforts of the great scientists who develop these vaccines, but it's also all the school nurses, all the people who are responsible for making sure that everyone has a safe, pleasant experience being vaccinated. And I think we're so lucky in this country that we can access these amazing vaccines for free. And parents, most of the time you don't have to do anything except remember to actually read and look at the consent form and send it back. It's no inconvenience to you, and we have such a brilliant system. I never forget how lucky we are, and particularly knowing that these vaccines have been in short supply globally for the last few years, and there's whole countries of girls who are missing out, who have very high rates of cancer in their country, who, because there hasn't been enough vaccine in their countries, not rich enough to afford it in the way that we can, have been missing out. So, I count my blessings every day, I guess, that, we are so lucky.
We are. Let's just get it on the table and be really clear about this. Who should be vaccinated and when? Who gets it for free? If you're over 25, do you pay for it or do you need to get it? And clear up for us. We have now, I heard the news that there'll be single vaccines in future. If you've already had one at school, does that mean you don't need to get the next one? Seems like an obvious question. All of those practical questions over to you, Professor.
When we first started giving these vaccines, we used to give them as a series of 3 doses. And the reason for that was very scientifically based. These vaccines are basically built of an outer coat protein of the virus. And usually protein-based vaccines, they're not that immunogenic. And by that I mean they don't stimulate a particularly fabulous immune response. So normally we have to show that antigen, that protein to the body, and then we let the body go away and make some antibodies, and then we have to show it again, and then often we have to show it a 3rd time before we're getting sufficient levels of antibody to be protective. So this is very much the traditional story with what we call protein subunit vaccines. But in this case, as I said, those virus-like particles that form the basis of this vaccine, they seem to be quite uniquely immunogenic. I'm going to use that word again. So stimulate a strong immune system. So really what our body's doing is making a reaction to these vaccines that's much more like the strong reaction that it makes to a real virus. And we think that this is why we've now been able to, we first of all showed that just 2 doses in young people was as good as 3 doses in adult people. And for the last few years, evidence has strongly been accumulating saying that just 1 dose seems to provide equivalent protection to 2 or 3 doses. Last year, the World Health Organization convened their expert committee to go through the evidence, make updated recommendations about how best we should be using these vaccines, remembering that there are massive price and access barriers to these vaccines, particularly in countries who just need it the most. They have the highest burden of cancer. And pleasingly, when they reviewed all that data, the expert committee concluded that giving a single dose instead of 2 doses seems to be perfectly effective.
Great news.
Australia, again, is being a world leader in this field. The vaccine that we use has not changed, so we're currently using what's called a non-valent HPV vaccine. That means it actually covers 9 different types of HPV. Of all those numbers, that's 16 and 18, those ones that we worry about the most. And then the next 5 most common types that cause cervical cancer. And we've kept those 2 types that cause warts. Now, the recommended age is 12 to 13 years. In young pre-adolescents, we get a fantastic immune response. At that age, obviously, most are not yet sexually active, and that is the ideal time to give them that protection so that whenever they do become sexually active, whether it's in 5 years or 10 years, they will already have that protection on board and they just simply won't have to worry about HPV-related cancers. It's been covered by the vaccines. ATAGI have said that you only need a single dose all the way up to age 25. So it's not just the kids at school who only need a single dose now. It's everyone up to 25. So if you missed out, if you were away from school, your parents didn't sign the consent form for whatever reason, but you now want the vaccine and you're 25 or under, you can go along to your GP, to your community health centre, to your Aboriginal and Torres Strait Islander health service, however it is that you feel most comfortable accessing vaccines with a trusted provider, and you can get a single dose and that will give you great protection.
That's great news.
And it is great news. And initially we very much said, it should only be given to people who are, ideally not yet sexually active. But the reality in Australia is even if you have been sexually active for a year or 2, it's very unlikely that you will have encountered those nastiest HPV types. So you're probably going to gain significant protection from vaccination, even if you are out of that target age group of 12 to 13, even if you're a bit older. It's a wonderful opportunity also for people who, may have migrated to this country after their school program and have missed out in their country of origin. They can access it as well. And I think that's really wonderful, because we don't want to see a situation where anyone who missed out on vaccine is the group where we're still seeing cancers. We don't want that to happen.
Is there anyone else you can think of who should be considering vaccine that we need to talk about?
Yeah, most of the time, most of us clear this virus without any problems. But people who have any condition that causes significant immunocompromise, so their immune system is not functioning as it should be, people who could be on immunosuppressants, somebody who is on treatments for some of the autoimmune conditions. Often they're quite powerful drugs that are needed to control those diseases, but they also have adverse effects on your immune system. And also people living with HIV. All of these groups, because their immune system is just not quite as effective at finding and removing many infections, but including human papillomavirus, these groups are more likely to have problems ranging from symptomatic HPV infection. So they're more likely to get, for example, if they get warts, they're much more likely to be more severe or more widespread. And they are more likely to have abnormalities detected at cervical screening. In fact, they are more likely, the global data would show, to actually go on to develop an HPV-related cancer. So if you're or someone you love is in one of those groups, it's really worth having a chat to your doctor about whether you should receive HPV vaccine. ATAGI, our specialist immunisation group, actually recommends that anyone who is immunosuppressed should consider receiving the vaccine. And the other group who ATAGI recommends, whatever age you are, you consider the vaccine, is men who have sex with men. Anal cancer is an HPV-related cancer, as common amongst men who have sex with men as cervical cancer was before we started screening. So anal cancer is a very rare disease, but unfortunately, for men who have sex with men, they have a higher risk, and HPV vaccine is recommended for that in that group for that reason. So it's really worth having a chat to your doctor. Now, if you're in one of these immunosuppressed groups, you will need 3 doses rather than the 1, and that's whatever age you are. If you are in the MSM group, the men who have sex with men group, if you're older than 25, you will need 3 doses as well. In fact, anyone older than 25 needs 3 doses. The other group of people who could have a think about whether HPV vaccine could be a good choice for them, any people with a cervix who have ever received treatment for those precancers. So if you had an abnormal pap test back in the day, or more currently had an abnormal HPV screening test and had to go on to have part of your cervix removed because of that precancer, this means that your body in the past has had trouble clearing HPV. So in fact, you're the very group of people who this vaccine is really designed to help. The vaccine wouldn't actually help you clear any HPV that's already there, but it would certainly stop you from getting reinfected. And so that could either be from a partner, or potentially if you did have some HPV left in your system, it could prevent it spreading and causing new disease.
This is a wonderful vaccine, and with the number of people getting the vaccine in the last 15 years or so, it's wonderful to see the results that we're seeing. And I'm hoping that having a single vaccine means the uptake will be even greater, protection will be good, and perhaps some of those vaccines will make it into those lower income countries and improve the numbers right across the world and reduce the amount of cervical cancer, which is a wonderful target for us to have globally.
By 2030, we want to have 90% of girls around the world having been vaccinated, and moving to a single dose, of course, makes this far more feasible. Get on track globally to largely get rid of this terrible, terrible cancer. And we're lucky we've had screening for so long that most of the cases of cervical cancer here that we diagnose, we still manage to get them at an early stage. But those late stage cancers that occur in lower income countries are absolutely horrendous experiences, and particularly for families and for women in their 30s and 40s, which is typically when they're getting these cancers. You know, they're often the main caregivers, the glue that holds families together. And those late stage cancers are just horrific experiences for everyone to go through, and there can be a lot of shame and stigma. So I think the prospect of being able to relieve that immense suffering and burden is just incredible. And obviously, as part of this call to get rid of this cancer, we also need to scale up screening and treatment. Many places in the world, there is no palliative care. You know, these people are left to suffer alone. And I think, you know, it's a reflection of how lucky we are, but also how much the work that we do here, the evidence that we gather on the effectiveness of things like vaccines, but also of screening and cancer treatments, can have a bigger global contribution to eliminate suffering. So, yeah, it's really, really important and exciting work. And I think we all play a part of it when we say, yes, I'm going to contribute to this effort. I'm going to make sure my kids are vaccinated. I'm going to make sure my aunt and my grandmother have their screening on time. You know, it's something that we can all be a part of, a big global movement to end the suffering related to this cancer.
The vaccine is a real success story. Thank you, Professor Brotherton.
Thanks so much.
If you've enjoyed Matter of Vax, please subscribe and share with your friends. You can also follow us on Spotify or wherever you listen to podcasts. For more Matter of Vax podcast and video education on this and other vaccine-preventable diseases, visit www.ifa.org.au. The Immunisation Foundation of Australia is a non-profit working to save lives through education and advocacy for vaccine prevention of disease.
Immunisation Foundation of Australia. Supporting immunisation, saving lives.